The goal of this program is to introduce clinicians, therapists, and mental health professionals to post-traumatic stress disorder, to help them learn what PTSD is, how it affects sufferers and their families, and how best to explain what PTSD is in a clinical setting. Dr. Frank Ochberg is a psychiatrist and former associate director of the National Institute of Mental Health. He is one of the team members who wrote the medical definition for post-traumatic stress disorder. Dr. Ochberg was the editor of the first treatment text in America for PTSD and is a recipient of the Lifetime Achievement Award from the International Society for Traumatic Stress Studies. Dr. Angie Panos holds a PhD in clinical psychology. She is a licensed marriage and family therapist and a licensed clinical social worker. She has more than 20 years' experience in traumatic stress treatment, dealing with war refugees, domestic violence, victims of rape, and child abuse. Dr. Ochberg and Dr. Panos are friends of Gift from Within. Historically, PTSD has been referred to as depression, anxiety disorder, paranoia, or battle fatigue. It has only been recently that the symptoms were seen in the larger context of post-traumatic stress disorder. Why is it important for clinicians to understand how to explain PTSD?
It's very important for clinicians to understand how to explain post-traumatic stress disorder to their clients, because they're setting the foundation for the information that that person needs to know to guide them in their healing and recovery process.
Explaining PTSD is actually an important part of treating PTSD. You're dealing with a situation that can be baffling to your patient, your client. They want to know that you are familiar with this. They want to know that when they talk with you about the event that happened to them, you're going to be able to handle it.
PTSD is insidious and can be particularly difficult to discern. What is PTSD?
Post-traumatic stress disorder is three things at once. First, being haunted by the event. The memory of the event, the sensations, the feeling of the event comes back when you don't expect it, when you don't want it. It can wake you up in the middle of the night. It can be like a hallucination during the day. The second part of PTSD is almost the opposite of the first. It's having emotional anesthesia. You don't feel. You're a diminished human being. You might think of this as something that fortunately protects you from feeling horror and terror, but unfortunately it robs you of joy and hope and love. And the last part of PTSD is like having too much adrenaline. You are jumpy, you're nervous, you can't concentrate, you don't sleep well. All those things happening for at least a month are diagnosed as PTSD.